Do you get outer hip pain when you're walking? Outer hip pain is extremely common, especially among women. But fortunately, there are some really easy things that you can do to relieve outer hip pain and be able to walk more comfortably. And I'd like to share them with you in this video. If you go to your doctor's office and you complain of outer hip pain, they'll probably press right here. They'll maybe take an x-ray to make sure nothing's broken. And then the most likely diagnosis that you'll get is hip bursitis. And you can't truly see hip bursitis on an x-ray, so there's no way for them to definitively know that. But there are a lot of different structures that run over the outside of your hip. The bursa is a little fluid-filled sac that sits between your gluteus maximus muscle and your IT band and the hip bone. It's basically to reduce friction between your hip. But there are also deeper muscles underneath your butt muscle called the gluteus medius and the gluteus minimus. And the tendons of those muscles are also a very common cause of outer hip pain. They're responsible for helping to hold you up balanced on one leg when you're walking. And so if they get irritated, they can be a cause of hip pain when you're walking as well. You've also got a long tendon that runs down your hip. It's called your IT band or iliotibial band. And that can also rub over the outer side of your hip and cause pain when you're walking. Furthermore, your sciatic nerve runs through the muscles in the back of your hip, and that can be an additional cause of outer hip pain. And that actually comes from your lower back. So there are many different things that can cause that outer hip pain, but fortunately they all come from one similar mechanism. So it doesn't necessarily matter whether it's the bursa or the gluteus medius and minimus or the IT band or even the sciatic nerve, because a lot of the things that you do to fix one of those problems, you'll do to fix the other problem. So what is it that causes all of those structures to become irritated when you're walking? Well, largely it's either a hip adduction movement where your pelvis drops and stretches the gluteus medius tendons and the IT band over the bursa in your hip, or it's a hip internal rotation movement which brings the bone of your hip or the greater trochanter forwards and overstretches the muscles around your sciatic nerve. And those movements are what irritate those structures. So if you can stop those movements when you're walking and prevent that adduction and internal rotation movement from happening at your hip, you can walk more comfortably without outer hip pain. So how do you do that? Well, you've got a few different muscles that control your hip motion when you're walking. You've got the tensor fasciolata, which is a little muscle that runs from the bone on the front of your hip to the IT band, and your gluteus medius and minimus muscles that I mentioned before, and then your hip external rotators in the back of the hip. And they all have to work together to maintain your pelvis level and your hip in a neutral rotation. So if you've got too much activation of this tensor fasciolata, it's going to cause you to come inwards. And so you want to make sure that you're getting your glutes activated. Now, if you stand with your weight on the opposite leg and put your fingers right underneath your hip bone, that'll be your tensor fasciolata, and then kind of on your butt muscle right here. So start out with the weight loaded on the opposite leg, and then shift your weight over onto this leg. And if you feel this muscle kick on, but nothing happening in your butt muscles, then you've got lazy glute muscles. And in order to be able to walk more comfortably without getting pain on the outside of the hip, those muscles have to work in equal balance. So when you load weight, you should feel this muscle kick on, but you should also feel these muscles kick on. So how do you get those muscles activated and wake them up? Well, start out in that same position and then put your outer side of the foot on the ground. So instead of putting your whole foot on the ground, put the outside of the foot on the ground and think about turning your knee out. And then load weight onto that leg, and you'll probably notice that you start to feel these muscles in the back kick on more. Those are hip external rotators, particularly the back part of your gluteus medius, and then those hip external rotators in the back. So load the weight on the outer side of the foot, shift weight over onto that leg, and you should feel your glute muscles, your hip external rotators, and some your tensor fasciolata all kick on at the same time. Now, once you take a step, you have to be able to pick this foot up off the ground in order to move forwards. So after you've gotten the glute muscles activated, then you want to be able to hold that. So try to keep those muscles activated and slowly try to put more and more weight on this leg until you can take this foot fully off the floor. And you want to make sure that when you take this foot off the floor, that you don't lose the activation of the glute muscles. So you've got to keep the glute muscles activated, knee turned out, weight on the outside of the foot, pick this leg up, and then you want to try to hold it there. Now, if you can't necessarily do that, it's okay when you're practicing to hold on to a wall or a chair or some other piece of furniture, get the glute muscles activated and turned on, and then you can even use your fingers here to make sure you're not losing it if you can't kind of tap into that muscle with your brain quite yet. Make sure you're feeling a contraction underneath your fingers, and then you're ready to take your next step. So that's getting those muscles activated and bearing full weight while keeping them activated. So the next step is to do that dynamically when you're walking. So you have to be able to activate one and then activate the other side and do that over and over and over again when you're walking. So start out stepping forward with one leg, put the weight on the outside part of the foot, get those muscles activated and make sure you feel steady over that foot, and then step to the other leg and try doing the same thing, turning the knee out, loading the weight on that leg, pushing off to the first leg, loading over the outside of the foot, turning the knee outwards. And one thing I didn't mention is that you may have to scrunch your arch or scrunch your toes in order to keep your foot on the floor. So squeeze the bottom muscles here, load over this leg, squeeze the bottom muscles there, load over that leg, and just practice doing that over and over while you're walking. Now, if you have some trouble doing that initially and you're not able to keep your balance, it is okay to use a cane. So hold the cane in the opposite side as your sore leg, put it on the ground, take a step, and go back to the sore leg again, take a step, and go back to the sore leg again. And that'll help you to maintain your balance a little bit better while you're doing the exercise. Now, another thing to note is that if you do have really bad hip pain when you're walking, you may need to use a cane or some other assistive device for a short period of time. And if you're worried about doing that, think about it like wearing an ankle brace after you sprain your ankle. You need to offload the tissues so that they have a chance to heal. And if every time you take a step, your hip's going inwards like that, you're overstretching those muscles and IT band, you're compressing the bursa, and all of those structures on the outside of the hip are getting re-irritated, and so they never really get a chance to heal. So if you aren't strong enough to maintain that position with the knee turned out and pelvis level, and you're not able to walk with weight on the outside of the foot and the knee turned out, then it may be a good idea to use a cane for a short period of time in order to give your tissues some time to heal up, as well as to allow those muscles to get stronger. And then once you're strong enough, you can get rid of the cane and not use it anymore. So what do you do if you've got really bad hip pain and you need help right away? Well, one of the common things that people do is they'll get a steroid injection or a cortisone injection in the outside of their hip. And for most people, that's okay to do every now and then, but there are a few things about steroid injections that you should know. One, they can weaken tendons and weaken bones. They can raise your blood sugar, for example, if you have diabetes, or they can make you kind of jittery or give you trouble sleeping at night. So you definitely don't want to have them very often. Additionally, although they're very strong anti-inflammatories, they don't fix the movement problem that caused that inflammation in the first place. And so once the shot wears off, it's very likely that the inflammation will come back. So you do still need to fix the movement problem. Now, if you're someone who is afraid of those side effects or doesn't like having cortisone injections, there are some alternatives. For example, dry needling takes a little acupuncture needle and it goes into the muscles and it can deactivate those trigger points in your gluteal muscles and often give people some very quick relief on the measure of within the first visit, it sometimes gets better. So that's an alternative, and that's one reason why we like to use manual therapies here at our office, both dry needling, joint mobilizations, or soft tissue treatments to the hip, because they do have the ability to quickly relieve pain. Now again, they don't fix the long-term movement problem, so you still need to do that regardless of what your short-term fix is. But I would recommend that you connect with an orthopedic manual physical therapist in your area to help you, one, figure out what's causing your hip problem in the first place, as well as give you hands-on treatments to quickly relieve the pain, and then teach you what to do over the long term to keep it from coming back. And if you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. Now, no matter where you're watching this from, if you found this video helpful, give it a like and hit the share button below this video to share this with someone else who may need to hear this message. Thanks for watching, and I'll see you in the next video.